This is the validation for wound packing. So first thing I would do is I would explain the procedure to the patient. Well, first thing I would do is wash my hands before I enter the room, and I walk up to the patient, do the identifiers times 2, ask them their name and date of birth, and then cross-check with the wristband or scan it if I have my computer. If all of that checks out, first thing I'll do is I'll explain the procedure to the patient. I'm doing a sterile wound dressing change and getting culture and irrigating. After I explain that, I would do my pre-assessment, which first I gotta check the MD orders, see what type of dressing they want, if there's anything specific they want to add into the dressing, if they want the gauze soaked in something. If nothing specific, then I'll move on to checking if the patient has any allergies, ask them and check their chart. If they don't have any allergies, assess their pain level, if they will need pain medications, check MD orders for that as well. After that, I will assess the top of their wound. This is going to be my wound today since I don't have too much. So I'll assess if there's any drainage coming through or blood coming through. If there is, I got to make sure I document that at the end. If there isn't, then I will put on my working gloves. I will first remove the old dressing and any packing that's in there. I will look at the dressing, and if the top dressing, there's nothing on it, I can dispose of it right away, and then same with the 4x4 gauze. If there's nothing on either of them, they can be thrown away right away. I gotta make sure I document what's on each level and what is there. And once I get down to the packing, that's where I gotta do more documentation on what it looks like. So I gotta look for the color, odor, consistency, all of that. Document how much of the gauze is wet, if it's fully immersed, if there's any blood, anything out of the ordinary, something that's been new, if it's a patient you've been seeing routinely, or if it's something that's been normal. So after that, I'll throw all that away. So after that, it's time to measure. So first, I gotta measure how long the wound is in centimeters. So this one is a little over, 5 centimeters exactly. I gotta measure the width as well. It's also 5 centimeters exactly, and then I gotta check how deep it is. So this is gonna be, obviously there's no depth, but I check for the depth. And after that, I would assess for any tunneling, and then I would use 2 swabs and go around the outside and find the deepest part and then measure that with my ruler. And lastly, I look for any undermining. If there's a gap going under the skin, I would use, again, 2 swabs and have them side by side. One is the edge of the skin, one is as deep. I measure with my ruler. Once I get all of that taken care of, next it is time to clean my wound. So first, I'll get my irrigation. I'll make sure I fully rinse out all the areas and make sure I get everything completely cleaned out. Then I want to assess what the actual wound looks like. If it's bright red, dark red, if it looks like there's skin breakdown, if there's any big drainages, anything new, a deep tunnel, anything out of the ordinary. After that is when I'll take my culture. So I'll use my culture swab and I will roll it side to side in a zigzag motion so most of the wound is covered. Typically I think it has 2, and then make sure I put it in my little culture thing, make sure it's completely in and sealed, then that'll be sent off to the lab. So after all of that is done, it's time to set up my sterile field. I don't have a sterile field, but here's my 3 sterile items. So first, most important thing is gloves. So open them up. Only make sure I touch the outside of the glove only. Or I mean the inside of the glove only, sorry. And this glove, my hand can go on the outside. This glove on the inside. I gotta make sure that it's, with my watch, it's in the way, but it needs to go 2 inches up my wrist. Keep my hands above my waist and below my shoulders. After that, it's first time to put my packing in. I don't have any packing, so I'm just using a 4x4 to go over top of the wound. Once that is covered, then I can get my abdominal covering, which that I will make sure it's fully covered. So that is the main sterile part of the procedure. After that, I can take these off. If I can tape with them on, it'll be easier, but I don't have any tape, so I'm just taking them off. So I gotta make sure each side of the wound is completely, or the packing is completely taped down, there's no gaps. Once that's taped down, I gotta make sure I initial time and date the packing. as well as throw away all my instruments, make sure everything's out of the way. After its initial time and date, I would make sure I document everything I've done, what I've used, what the wound looked like, what the drainage looked like, anything I measured, everything I did virtually, I will have to make sure I document. And after everything is documented, I will make sure I clean up my cubicle, and then that's it.